This is a video for basic facial, and the basic facial starts as I arrive to work. So the first thing that we do upon arriving to work is we wash our hands. So we are going to wash our hands, wet our hands, get a coin-sized amount of liquid hand soap, and we're gonna wash them down to our wrist. We're gonna wash the back of our hands down to our wrist. We're gonna wash our fingers, and we're gonna wash the backs of our fingers. We're gonna wash our fingertips and our thumbs. We're gonna wash between our fingers. We're gonna wash between our fingers and our thumbs. We're gonna wash our thumbs. We're gonna wash our wrists. And we're gonna do all of that washing, interlocking for a minimum of 20 to 30 seconds. Then we're gonna thoroughly rinse our hands underneath the sink. When we feel like we've gotten that proper rinse, we're gonna grab either paper towels or a clean towel to turn the faucet off, dry our hands completely. Paper towels would go in the trash. The towels, now dirty, it would go in a closed container until time to do the laundry. Then we find 70% ethyl alcohol hand sanitizer and we sanitize our hands. After we have finished sanitizing, we are going to set up our room and get it ready. And to prepare our room, the first thing that we're going to do is disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We're going to check our equipment to make sure that all of our devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. We're going to turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We are going to fill a clean steamer glass with distilled water and preheat the steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We're going to prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. We're going to close the lid to the product and set the portion cup tray on the tray. We're going to drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place the clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. And just a note there, we're doing all of this ahead of time because we have appointment times. Our client has an appointment time. We want to be prompt with that. So we want to do everything that we possibly can prior to the client's arrival so that we're on time and task, we're professional, we're respectful of their schedule and our schedule. So we're going to have everything that we can set up and ready and prepared before the client even arrives. On our tray's already been set up. It's ready over here. So I have water, I have 4 squares, I have 2x2s, cotton rounds, I have disposable gloves for extractions, I've got toner, I've got astringent and makeup remover, I have cleanser, exfoliant, I have massage product, I have a mask, I have eye cream and moisturizer, I have my wooden stick Q-tips for my extractions, I have a fan brush for my mask application. I'm pretty much ready to roll. Because I've prepared. And the other thing is, this particular client is an existing client, so I kind of know our plan, but you can have all of those things set up and maybe just not dispensed if you don't know particular skin products that you're going to use or actual, like what cleanser, etc. If you've never met your client, you haven't done your client consultation, but you can have everything out on your tray ready to roll with the exception of just then having to prepare the tray once the client gets into the room. So the tray's ready, it just doesn't have the products dispensed, that's all. So what we're going to do now is we would move forward to our client consultation step, which is critical and very important in this entire process. So I'm going to read through and kind of review on a lighter note, but it's really, I'll touch on some things, but it's really critical and it really does make a huge impact for your success with your client's skin and your business success. So let's talk about client consultation. And when I meet and greet my client, I'm always doing that with clean hands. You saw me clean my hands a minute ago. We're going to clean them again before I actually start the service. But I would have cleaned them at this point to go and meet the client, just noting that. So we're greeting the client. We're escorting them to the work area. And we're going to just sit down, talk to the client, determine the client's preferences. We're going to assess the client's needs. We're going to assess the client's skin by performing a skin analysis, initially by just looking at them, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours, and we're going to consult on any known allergies. Obviously, we need to know what they're on and what they're using, because all of those things could affect the skin. We also need to know if they have specific allergies, because we need to know if there's anything in our products that we plan on using that they might be allergic to. We're going to consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. If they have one and we can see it, you absolutely are not going to be performing this service. We're going to assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. Once again, those are all contraindications for facial. We're not going to do it if they have been using any of those, or had facial injections within the last 3 weeks. So if your client is free from any of those contraindications, you can move forward with the procedure. And this is where you really need to make sure that you take the time to review all of that, because you are their skincare professional. So if you don't know something, you need to call somebody or you need to look it up. It's really, really important that you are conscientious of a client's health and skin, and that you're not putting them in any kind of jeopardy, or that you wouldn't want to harm their skin in any way. So that's just a given. Thankfully, our client does not have any of those contraindications, and we can move forward and get her set up and ready for a facial, because all systems are go. And remember, she's an existing client, but we still go through all of those details, because every time she comes in, we add to her client card. If you're using a client card or if you're using a software system, you're going to always update the services that you're doing, anything that you're seeing. You're going to go through all the specifics every single time, so you have a really detailed record, especially if you've got a plan and you're doing different services every time. This time is a basic facial. So you will give the client some privacy. You've made the bed, you've laid out the drape, all the things that they need to change into. So you're going to close the door, let them change, and get onto the facial bed. Then you'll come back, knock on the door when it's time for you to enter, and if they give you that permission, you come on in and you just help them get more comfortable. So all we're going to do, she's ready, is add to her comfort at this point and check in with that. So we've got a rolled towel here that we're going to place underneath the neck for more support. We have a towel that we're going to drape just to give her a little bit more coverage over the décolleté, etc. And then I've got a hairnet that I am going to put on to keep her hair out of the way of her eyes, etc. And then before we start the facial service, I'm going to wash my hands. So I would go to the sink, wet my hands, find that coin-sized amount of liquid hand soap. I'm washing my hands together down to the wrist, and then I'm washing the back of my hands down to the wrist. I'm going to wash my fingers. I'm going to wash the backs of my fingers. I'm going to wash my fingertips and nails. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs, and I'm going to wash my wrists. I'm going to do all of this interlocking wash for a minimum of 20 to 30 seconds. And when I feel like I've gotten everything nice and clean, I'm going to give it a thorough rinse under the sink. And then I'm going to find some disposable paper towels or a towel to turn the faucet off, dry my hands off, throw the paper towels in the trash. If it's a towel, it's now dirty. It's going to go in a closed container until laundry. And then I'm going to reach for my hand sanitizer. That's 70% ethyl alcohol, and I'm going to sanitize my hands. And then and only then can I start performing the facial service. So I'm ready to do that now. So the first thing that I'm going to do for her is I'm going to remove makeup. And some clients will wear more, some clients will wear less, so you just take your time here, and we're going to remove makeup. And then I'm going to go ahead and do my first cleanse on her skin. And this initial cleanse here, I'm going to be removing that makeup, that initial dirt and debris that might be on the face. And once you've done that initial wash, you can remove that first cleanse. And then you're going to take a second here because we're going to do the skin analysis. So you want to protect your client's eyes. So you're going to cover up their eyes, and you are going to bring in either a magnifying lamp or Woods lamp or both. and the light is very bright. So you need to cover your client's eyes, and I do not have that, so I'm just going to pretend. So you're going to bring that magnifying light in, you're going to turn it on, and this is where you're going to take some time. So you really want to give the face and the neck, etc., and décolleté if that's part of the facial that you're doing. You are going to give yourself a proper bit of time to look through the magnifying lamp and really analyze the skin. And you're looking for a whole lot of different things. Maybe they have given you some concerns. Maybe their concerns are that they're worried about discoloration or hyperpigmentation. They feel like they're also super oily and maybe breaking out right now. Or maybe they're dehydrated. They're worried about aging, premature aging, or fine lines. Maybe they're concerned about redness or broken capillaries. We could go on and on and on. Texture, dullness of the skin. They could tell you so many different things, or you could look for so many different things, but this is where you really need to analyze your skin, analyze your client's skin every single time, whether it's their first visit or their millionth visit, because there could be changes and you want to see where you're at. You want to see where you're at for improvements. You want to see where you're at for where you could improve. You also want to look for any changes in the skin, because you're going to be notating all that, and because you're their skincare professional and expert, you may notice something that's changed that might require someone to look at that's out of your scope of practice. So maybe a mole has changed slightly, or maybe something has appeared that wasn't there before. This is where you're going to document all of those things on her client consultation forms, or if in your software system, however you do that for your clients. So it's very important and critical that you take your time right now to do the things in this viewpoint that you need to, not only so that you can get the best out of this service, but then you're going to be able to recommend proper home care, because she's at home more than she is with you, and also maybe possible recommendations for services in the future that would really make a big impact. So once you're done, you can turn the light off and take it out of the way, and then you can remove the eye coverage and just put it to the side. And you're going to go ahead and do a second cleanse now, because she's still not fully clean. And that was obvious under the magnifying lamp. And then you're going to remove that second cleanse. And then you're going to go in for your third and final cleanse. And maybe everybody doesn't need this. This client's going to have it today. If there's any last little bit of anything, this is going to take care of it. And with every single part of a basic facial, you're avoiding the eyes, the nose, and the mouth. You don't ever want to get anything in them. We're working around them. And then we can go ahead and remove that final cleanse. So we've definitely got her nice and clean. No doubt about that. Once you've got all the cleanser off, you can go ahead and tone. So we're going to use a spray toner, and I'm just going to make sure that my nozzle does not come into contact with my cotton rounds. And then we will go ahead and move forward. And the next step that we're going to do is exfoliation. So I'm going to get about a pea-size amount of my exfoliant. And just note that you're always going to follow manufacturer's directions. So it may be different for everybody. And I'm going to spread it out on the face and the neck before I start to massage it in. And then I'm going to, not massage it in, but massage it for 2 minutes, 1 to 2 minutes. So just so you know, you're always going to read and follow instructions on that to make sure that you're working with it properly as you would any of your other items. And this, of course, we are going to, like everything else, we are avoiding the eyes, the nose, and the mouth. And then once you've done your massage, we're going to read some instructions of what we would be doing next, but we don't have some of that equipment, so I'm going to read through it. You would retrieve the steamer and turn it on. You'd position the steamer next to the facial bed. That is, make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, we're going to position the steamer 16 inches over the client's face, aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So we would just go find the steamer, the one that we've preheated with the distilled water and all of that, bring it over to the facial bed, turn it on, and make sure that the little nozzle where the steam comes out is not facing the client. Then it's going to get a little even flow of the mist. Then you can turn it and position it, aiming it at the client's chin, 16 inches away, and let that steam evenly go over to the client's face for 3 to 5 minutes. So we're going to pretend for the sake of the video that that time has passed. So we're going to turn the facial steamer away, turn the steamer off, take it back to where we originally got it from. We'll leave it there until the end of the facial when we can come back and disinfect. And then once that time has elapsed, you can remove the exfoliant. And I don't have a cabbie, hot cabbie either, so I'm going to get a steam towel just pretending, shaking it out because it's hot. I'm going to touch the inside of both wrists. I'm going to check her collarbone with, yep, the temperature's fine, okay, good. And then we're going to go put this on top of the client's face, covering the eyes but leaving the nose out so that she can breathe. And just do a gentle press. And you have about 20 to 30 seconds before these steam towels start to cool down, so it won't be a long time before you just wipe everything off. You'll start to feel it cool down and you'll know when to take it off. And then make sure your hands are nice and dry because it's time for extractions and you have to put gloves on. And it's very difficult to put gloves on wet hands. There's a couple ways we can do the extractions. You could take 2 cotton rounds, soak them in astringent, wrap them around your fingers, and then do your extractions that way, and as you're working around the cotton rounds, and then throw them away. I'm going to use wooden stick Q-tips. So you would be taking 2 wooden stick Q-tips, soak them in astringent, and then throw them away after each extraction, which is what I'm going to do. So I'm going to soak them in the astringent, and I'm going to come in here. She really only has a couple of extractions around the nose. Now, I would normally cover her eyes and bring the magnifying lamp over if I needed to see what I'm doing, which is usually what happens. So make sure you note that at this point you cover eyes, bring in the magnifying lamp, turn it on, and then you can perform your extractions looking through that magnifying lamp. So when you're done, you toss it. Get a couple more. And with extractions, you don't want to do extractions for any more than 5 to 7 minutes because it can be painful. So just get it done, but don't hang out forever so the client is still very comfortable. And that was the last one. So once you're done with your extractions, you get to remove these gloves and toss them as well because you use them for extractions. You will not be keeping them. You'll not be keeping disposable gloves ever. So you're just going to take a minute, take your gloves off, throw them away, and then you'll finish with toner. So you exfoliated, extracted if necessary, and then toner. So once again, when I reach for my toner over here, I'm not going to let the nozzle touch the cotton rounds for sanitation purposes. I'm just spraying and my toner is just touching the cotton rounds. And the nice thing about once you've finished the toner and you've done extractions, you're going to be moving forward into the massage, which is a nice, if she's been through a little bit of pain, then she gets a massage, which is great. However, if it's someone that has severe acne or cystic acne, you would not be doing a bunch of massage. So just note that it would be a different kind of facial. And when you're doing your massage, one of the most important things to keep in mind is that you need enough massage product before you start the massage so that your hands don't have to leave your client. So you want to go ahead and get all that massage product on your hands and spread out on the client so that you know that once you start the massage that your client can totally relax and you don't have to worry about disturbing them by leaving, like stopping, starting, the touch leaving, because the touch is important. So we're going to go ahead and get started and let that client relax. And then you'll remove the massage product. And then we'll be applying a mask. You're always going to follow manufacturer's directions. I'm going to be using a fan brush to apply my mask. Always, always, like everything else, avoiding the eyes, the nose, and the mouth. And then based on the type of mask, manufacturer's instructions, etc., you would have a certain time frame that you would leave the mask on. And for our video, we're going to say it would be anywhere from 5 to 10 minutes. So we're not going to sit here for 5 to 10 minutes because it's a video. We're going to go ahead and think that that time has elapsed, and we're going to remove our mask. And then once you've completely removed your mask, you're going to tone. One final tone. And once again, I'm not going to touch the cotton rounds with my spray nozzle. And then we're going to apply skincare to finish up. So my existing client, I know what she currently uses and what we're adding in. And today we're going to really pamper her. We're going to give her a nice eye cream and a nice moisturizer with sunscreen. So we're going to be doing a little bit of an eye cream. Of course, we're going to use our ring fingers, most delicate fingers on the hand, and we're going to tap a little bit on that zygomatic arch and then the brow bone gently. And we're going to put on our moisturizer with SPF, a nice hydrating one. And we'll be applying it everywhere we possibly can. She already uses this product. She's really good about sunscreen. She's an existing client, so we've really made that clear of how important that is, and she's been really good about it. So I'm pressing it to the face. If her ears were showing, I'd even put it there, her décolleté, the neck, everywhere she might need it, gently. And then I'm also going to give her a little bit of a lip hydrator before she's presented with her skin, so that everything looks moist and beautiful. And she looks absolutely divine. So we're going to give her some privacy. We're going to let her change, and then she's going to be meeting us out in that client consultation area, because we are going to go over maintenance and aftercare, and then discuss her next appointment, because we have a goal in mind here, and so she's on track for certain things that she wants to have done with her skin. So we're going to go ahead and get her booked, and then make sure when she goes home, though, she is taking home a few products, she knows what to do with them, and then we can get her checked out and on her way. Then we need to get back to prepare for our next client. So when we get back to the room, the first thing that we're going to do is look for any single-use items that we haven't discarded, and get rid of those, toss those. We're going to take all the bedding, the sheets, the towels, everything, put it in a closed container until time for laundry. And then we're going to get any implements that are dirty, put them in a closed container labeled to be disinfected. Then we're going to identify and find a cleansing agent, and we will read the manufacturer's directions, follow manufacturer's directions for mixing and usage, wipe down our workstation and area for any debris, and then everything's cleaned up there. We're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You're going to need to grab some disposable gloves, because as you begin to read to follow those manufacturer's directions, you're going to realize for a disinfectant you have to put disposable gloves on. You'll follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You'll disinfect electrical equipment, store it in a clean area separate from other implements like your steamer, and then toss those gloves, because it's going to be time for your final hand wash. So you'll go to the sink, you'll wet your hands, you'll find a coin-size amount of liquid hand soap. You're going to wash your hands together down to the wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers and the back of your fingers. You're going to wash those fingertips and nails. Wash between the fingers and the thumbs. You're going to wash your thumbs. You're going to wash your wrists. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And then you're going to thoroughly, properly rinse when you feel like you're clean. Rinse, rinse, rinse. And when everything's been rinsed off, you're going to grab either disposable paper towels or a towel. Turn the faucet off. Dry your hands completely. Paper towels go in the trash. If you used a towel, it's now dirty, and it would go in that closed container with the other dirty linen until time for you to do the laundry. And then you can go ahead and get ready to set up for your next client. So this concludes the video for basic facial.